LaCourse, and manager with EchoHawk Consulting, and it's my pleasure to welcome you to this morning's webinar, Charting Pathways on Early Childhood Development and Nutrition for Minnesota's Native Children. Through a few housekeeping items. The first is to just let you know that our presentation will include a variety of topics that will be covered by various speakers, and that will be followed by an interactive Q&A session. This session is being recorded, and the webinar recording will be placed on the Seeds of Native Health website here in the next few days. At the conclusion of the presentation, all of you participants will be welcome to submit questions using the chat or question box features of the webinar. Now I'm going to turn it over to EchoHawk, who is the president of EchoHawk Consulting. Crystal?
Thank you, Shirley, and good morning, everyone. It's an honor and a pleasure to be on today. As Shirley said, my name is Crystal EchoHawk Consulting. I'm from the Pawnee Nation of Oklahoma, and I'm really pleased to be able to not only serve as a moderator today, but also as a panelist. So let's get started, and really to just start off by giving next slide, Shirley, to give you an introduction to the Partnership for Healthy Children, Healthy Nations, and HCHN, as we call it, really a product and a collaboration with the Metawakanton Sioux communities, Seeds of Native Health Campaign, the Better Way Foundation, and the Federal Reserve Bank of Minnesota's Center for Indian Country Development. And just over a year ago, these three partners really embarked on what was a very ambitious project. And it was all about looking at how to improve the health, the lives, the educational outcomes of Minnesota's young Native American children. And really the driving strategy behind that was to go out and do research and really to look at how these partners could convene diverse stakeholders from across the state to learn more about how we could better serve Minnesota's Native American children in order to improve their well-being and educational and social outcomes. And the report that was just released just a few weeks ago is really a culmination of a lot of research, learning, listening, relationship building, and synthesizing for different types of perspectives from diverse stakeholders, guidance, and really looking at how we started to build consensus across different stakeholders and communities. And we are really, really excited about what we heard over the course of the last year, which we're going to get more into. And we really heard a lot about people's willingness to break new ground, to really forge new collaborations, new partnerships, and to think outside of the box to really ensure that Minnesota's Native children, their families, and their communities are physically, mentally, and culturally healthy. Next slide. So I'd like to introduce our panelists that will be joining us today. First, we are joined by Patrice Kunesh, who is Assistant Vice President and Director at the Center for Indian Country Development of the Federal Reserve. We are also joined by Andreas Hippel, Executive Director of the Better Way Foundation. We also have on the line Chris Georgakis, Managing Consultant for the Seeds of Native Health Campaign at the Shakopee Metawakanton Sioux community, and also President and CEO. We also are joined by Rob Grunwald, who is an economist at the Federal Reserve Bank of Minneapolis, and Dick Todd, who is Senior Advisor to the Center for Indian Country Development at the Federal Reserve Bank of Minneapolis. So without further ado, I'd like to start to turn it over to our panelists, and our first panelist that will be speaking will be Patrice. Next slide, Shirley.
Good morning, everyone. Thank you for joining us today. This is Patrice Kunesh. I'm the Center Director here at the Minneapolis Fed, and I'm happy to have you join us with this important conversation. So our inspiration for Healthy Children, Healthy Nations Collaborative came a few years ago. We were inspired through our work around a conference that we held here at the bank on early childhood development in Indian country. We really wanted to delve into both the science and the economics of early childhood development So we took a look at brain development in the context of historical trauma. We also looked at the economics of interventions and positive program support around early childhood development. And what we found is some very high results, high return on investments that show that with supportive and quality early childhood development programs, we see an exponential return on investment. We wanted to use that ECD conference as a springboard, and so the three of us, Shakopee, Better Way Foundation, and the Center for Indian Country Development, formed a collaborative partnership. And we know that ECD is much more than school readiness. It includes social, cultural, emotional, and physical well-being. So we also know that and believe that Indian child development is for all children of all ages, especially with that important early start. And it's one of the best strategies for both the child and the community. We also know that early childhood development for Native kids needs to include nutrition and language development. So we're looking at developing a more holistic approach that connects healthy children to healthy families and ultimately to build healthy communities, healthy tribal nations. So to do this work, we need to invest in ways that connect promising models and strategies to impact developmental outcomes for our Native children. Our goals with this work are threefold. One is to better understand the context, needs, challenges, strengths, and opportunities for enhancing ECD, as well as nutrition and health outcomes for Native American children in Minnesota. We want to map and track the good work and the really good practices that show promising outcomes. The assessment side is as important as the delivery side of these programs to ensure a really well-calibrated program that fulfills the basic needs and delivers the necessary services and produces the best outcomes. Next slide, please. So in our process, with the backdrop of the importance of early childhood development, with focus on Native American children, we really want to make sure that our investments pay those dividends in long-term social and economic benefits. So we established a process to investigate the state of early childhood development in Minnesota's Indian country. We conducted baseline research to understand the context and programs in Minnesota associated with Native American early childhood development, as well as nutrition and health components. We began listening to practitioners and advocates, funders, and tribal leaders to hear their perspectives on education, on community well-being, and what are the drivers in their communities that are either driving or detracting from healthy communities. We then started a dialogue with these groups to build consensus around priorities and pathway forward. We hosted 3 convenings last year in the spring and the summer. In May, we hosted the Minnesota-based early childhood development programs, nutrition and health practitioners. We brought together researchers and advocates for a really rich and robust conversation. In July, we then turned to the funders. We brought together philanthropic organizations that are very important to this endeavor as well. And then finally, in August, we brought together the tribal leaders because they are the ones who are making the decisions that are impacting the community, and they're the ones who are directing funds for their communities as well. We gained such valuable insight into the current programs and funding streams, and we discovered gaps in program support, as well as innovative practices that are really making remarkable differences in our Native communities. With that, I'm going to turn it over to Andreas Hippel.
Thank you, Patrice. And next slide, please, Shirley. Thank you. It's just my pleasure also to be on this call, on this webinar. And as much as I don't want to start with the negative, I think it's important that we go over some of the challenges that we found in the course of this process, and then we'll move towards some of the reasons that I think this is actually a very optimistic report. But looking at the context requires us to be sober about what we're dealing with here, and it's a set of challenges that are complex, that have their roots in deep historical trauma. And one of the things that we found in this process was just how clear it was that historical trauma has a deep impact on ECD. We found more than 5,000 Native American children under the age of 5 are at risk of starting school behind in the state of Minnesota. The teen pregnancy rate, which is for Native kids ages 15 and 19, way higher than for any other demographic. Infant mortality rates more than twice that of white people. The 2012 to 2014 data shows that 40% of Native mothers reported that they smoked during the last 3 months of pregnancy, and that compares to 12% of whites. At the same time period, a third of pregnant Native mothers experienced food insecurity, and that's these are deep-rooted problems, deep-rooted challenges, and they play out every single day. The environment is an important part of this, so the economic conditions we're working in, and this is part of the reason for me that our partnership on the foundation is so important to be. It's so important to be benefiting from the analysis of the Center for Indian Country Development at the Fed, as well as the perspectives of the Shakopee, Mdewakanton, and Sioux community and the team there. We learned about the 50% of young Native children that actually live in, this is not news to in a household making
Andreas, I think we're losing you.
Okay.
Yeah, I think
Crystal,
you cut
do you
out
want to take over?
last bit. No, go ahead and try one more time. I can hear you clearly now.
Okay, great. And apologies, everyone. I'm actually in Tanzania for this. So the unemployment challenge is another significant one that we're dealing with. In the data that from 2011 to 2015, the share of Native men ages 16 to 64 without jobs was 49%. Again, comparing to 19% for white men. For Native women, it's 47% compared to 23% for white women. These aren't just small statistical blips. These are consistent. This is consistent data that is deeply significant. Native children are frequently unprepared for school and rapidly fall behind their peers. They have the lowest rate of kindergarten readiness in the state at 44%. 70% of Native children in elementary and middle school don't meet the standards in math. 65% don't meet the standard in reading. The lowest graduation rate for Native students is in the whole nation is in Minnesota, and it's at 45%. Native students have the highest rate of attempted suicide among 9th graders and the highest rate of death by suicide by all age groups. Adverse childhood experiences range from physical, emotional, or sexual abuse to parental divorce or incarceration of parents or guardians. And Native kids have the highest rate of ACE exposure experiences than any other population in Minnesota. That's what we're up against. And when we look at that, it's easy to be discouraged. But as I said, fundamentally, this is a positive, optimistic report. And Shirley, if you go to the next slide, please. One of the things that makes me so optimistic about this work and so excited about what is to come is that we're building on tremendous strengths and assets. And on the front lines, many of you on this webinar who are working on this every day, know that there's just tremendous strength in Native culture, in tribal institutions. There's training and technology that are being brought to bear on these challenges. We've identified the needs and the gaps around physical and mental health, professional development, food systems, cultural programming and engagement and sustainability. These are all areas that people are working on, creatively. They're keys to developing the network that we have that we're in the process of developing, the key to developing its growth and its longevity is around communication and networking. We've developed an action plan in this report. We've engaged tribal leadership, and I've taken from this process really a sense that there is a moment in time now where voices and energy and action are coming together to find real solutions that are rooted in community, that are rooted in tribal cultures, that are rooted in all the best approaches that will bring real meaningful change. Obstacles, of course, to achieving the framework that we've laid out include just the challenges of collective action in general. We work in an unclear policy environment, the multi-generational trauma, sovereignty continues to be poorly understood. There are not culturally based education systems that we're operating in. Plenty of stakeholders are disconnected from the important processes of decision making and from the decision makers themselves. In the report, we lay out some of the best practices for ECD that we've come across both in Native communities and elsewhere. And so how do we define success when we're trying to really tackle these challenges and these opportunities and seize these opportunities? What is success for us? And what we're laying out here are a range of areas. And I think there's very much a sense that success is defined differently. Success should be defined by the individual and by the community. And when we started laying out what our measures of success are, we began by talking about community-driven activities. They should be that's the core of this. That true sustainable ECD systems require deep community leadership and involvement. Access, safety, and the ability to meet community needs is a part of it. Healthy babies being born is part of it. Program collaboration, sharing of responsibilities, inclusive decision making. This is essential. Healthy children and families. That includes spiritually, emotionally, and economically strong and healthy families. Incorporating Indigenous perspectives throughout. That's essential. We can't do this without that. Community reinforcement of language use, and there's tremendously innovative work on language use and revitalization in a number of communities across the state. Alcohol-free events, that's important to this. Decreasing disease and increasing health, because the health context, of course, of ECD is essential. And success for us is also improving the ability to handle stress and trauma. Recovering from trauma is an important part of true success in this endeavor. When we look at what rural and urban success relies on, and we're thinking, and our approach to this is very much focused both on rural and urban Native communities. It relies on cultural values and traditional ways being deeply informing and guiding this work. And it relies on Native peoples working within institutions and within systems on issues supported by organizations from a variety of directions. Strong leadership that can guide and advocate for people getting on board. We need leadership that understands that quality matters and that when we require additional resources is willing to work for them. We need to listen to and uplift elder voices and youth voices. There's a lot of wisdom in both ends of the spectrum. Adequate and sustainable resources, we need sustainable commitments, and for Better Way Foundation, that's certainly something that we're trying to bring to the table from our perspective. Our board made a 5-year commitment to ECD in Indian country 2 years ago, and I dare say it's going to go much longer than that. We're excited to be part of this work. We believe in effective communication to community throughout this work. We need Indigenous-led models, community awareness to build and commit to action. We need the development, training, and support for professionals. We need parent support to understand their role and significance. We can't do this without parents as well. And then tribal visibility for the policy change at the state level. There's work to be done at that level, and coordinating it and connecting it to the rest of this work is only going to make that impact that much stronger. So I'll hold up there and turn it over to Chris Georgicus.
Thank you, Andreas. And let me just say, very pleased that all of you could join us on this webinar today. We are excited about the interest that the Healthy Children, Healthy Nations initiatives final report is generated. And one of the things that is contained in the report, if you've had a chance to look at it, is that we have highlighted a number of programs which demonstrate success across early childhood development, nutrition, and cultural development. Programs that really provide the sort of models that we're interested in encouraging elsewhere, in replicating and inspiring others. There are 7 programs that are described briefly, that are worth highlighting and described briefly in our report. I just want to touch on 3 of them and just give you a very quick sort of snapshot of these kinds of programs that provide tremendous impacts for the sort of small programmatic investments that have been made in them, and that have great potential of being replicated within other communities throughout Minnesota. The first one, Wikeoye Nadigan Kandan Early Childhood Urban Immersion Program, is an immersion program in Minneapolis for both Dakota and Ojibwe language. It's for children from the ages of 16 months to 5 years. It's connected with both K through 5th grade and 5th grade plus programs to ensure continuity and access beyond their programs. There is a 5-year data collection effort which is being undertaken. And already the data is showing that students are scoring much higher on social and emotional development screeners than children who do not have the benefit of these immersion programs. Secondly, the White Earth Band of Ojibwe's early childhood and early child care programs involve 2 licensed child care centers for 0 to 6 and 0 to 3 kids. They offer programs which assist in physical, cognitive, social, and emotional development. Each center incorporates Ojibwe culture, themes, and language. The programs are recruiting, licensing, training, and monitoring child care providers for both in-home and non-residential settings on and near the reservation. Currently, these programs are supporting 21 providers, 18 of whom are part of the Parent Aware statewide services program to find and provide high quality child care. And these programs collaborate with various other partners to provide additional resources such as community events, screenings, the Caring for Kids store, and other programs. The third program that I just want to touch on very briefly is the Dream of Wild Health, which is in the northeast corner of the Twin Cities metropolitan area. In Hugo, it brings farm fresh foods to Dakota and Ojibwe communities in the metro area. I've seen it myself. The program teaches young people to become what they call garden warriors, who graduate into youth leaders, becoming role models, advocates, and practitioners of traditional Native foodways. I have to tell you, I've seen these Native youth. They are absolutely phenomenal young people, and the care that the Dream of Wild Health leaders provide really is a tremendous model that could be replicated across other areas beyond, developing a farm and gardens. These programs teach young people to be able to help their families understand the importance of eating healthier and reconnecting with their cultural life ways and food ways. All programs that are exciting. If you dig into the report, you'll see other really inspiring programs that provide the sort of models that we're interested in replicating. And with that, we can go to the next slide, and I'm going to turn it back over to Crystal.
Thank you so much, Chris. And before I jump into this exciting framework for collective action, I just want to remind folks that if you have any questions, I would go ahead and start entering them now into the question box, because we will have a Q&A session at our webinar. So feel free to start sending questions now. But really, looking at this framework and the 4 strategies for action, and as we have discussed, this was well over a year-long process, in which we engaged diverse stakeholders, and there were over 140. from diverse backgrounds, whether in early childhood development, nutrition, different aspects of health, tribal leaders, funders, just all kinds of stakeholders across the state. And what was so interesting as we went through this process is that very early on, some very distinct themes and trend lines really began to emerge. And we really began to see a consensus emerge around what needed to be areas that needed to be prioritized in terms of focus, and things that needed to be really uplifted as strategies that Native communities want to lead and really want to invite non-Native partners to engage in. And so when we look at this framework for collective action, it's I think one of the most important things here is to note is that this is not a plan. It's really about a starting framework that highlights some of the most important priority areas to address, and really, again, consensus on the best ways, to engage in these areas. And really, in looking at these focus areas, we have 3, which is Native early childhood development. The second is healthy early Native nutrition. And the third is whole, healthy children and families. And then when we look at the pathways, or, also thinking of them as strategies, one is to really invest in community-driven solutions, to support and engage in knowledge building and sharing, and that really means across Indian country and Minnesota, but also with non-Native allies and partners. Another pathway is really around convening, network building, and collaboration, and that's something we heard a lot about during this entire process through Healthy Children, Healthy Nations, how much these different stakeholders really enjoyed the opportunity to come really talk about these different issues and to have their voices heard. And the final pathway area is really around advocacy and policy change. What is not reflected on this slide, but as you will see in the report, that a really critical part of this framework for action is not only the focus areas and the pathways, but that it's really guided by 7 core values and principles. And I think that is what makes a really strong foundation for this, and also really gives a framework how different communities and stakeholders need to engage. And really want to highlight some of those core values, which include a respect for tribal sovereignty and traditional knowledge and culture, and really as a value in recognizing that issues are interwoven, and we can't compartmentalize. We really, when we're approaching this work, we need to approach it in a way that we understand that at any given time we need to look at how we can be pulling multiple levers. And I think one very strong value was the need around to dismantle structural racism within the state of Minnesota and nationally, and that we really need to tackle and address implicit and explicit bias and really strive towards racial equity. And then I think another important core value is understanding that healthy tribal nations are going to equal healthy Native children. And so really, as we look at this framework for action that is around these focus areas, these pathways, and these core values, what this all means, and as it comes together, is that as we're working in these areas and working together to pull multiple levers moving forward, that we really truly believe that we can strengthen and sustain an increasingly, healthy and a most certainly vibrant and diverse ecosystem for Native children and early childhood development, in nutrition, and in health. And so with that said, I would like to turn it over to Andreas to talk more about our strategies for action, with the first one being aligned grant making. So Shirley, next slide.
Great. Thanks, Crystal. And from Better Way Foundation's perspective, we've been working with Crystal and her team at EchoHawk Consulting for 2 years, and I just want to say tremendous impact on this work and leadership of this work, and thank you. When we talk about aligned grant making, it's part of what I'm really excited about with this, and I believe deeply within philanthropic efforts in general that when you can come together and collaborate and leverage ideas and funds and resources, then the sum is typically greater than its parts, and that's what we're hoping to build here. We're essentially working towards a very long-term approach, one that we think can have results in the short and medium term, but that reflects that this is a long-term effort. We were advising really on ongoing versus one-time funding. We know these efforts, change takes time, and we need to bring that to any collaborative and grant making that we bring in. Group funding is another piece that we think is important in aligned grant making. Having just one-on-one funding with one funder supporting a project is suboptimal. It's better to have a number of funders coming together, bringing different perspectives and networks and resources and investment into it. We think there's value in flexible grants that really earmark grants for ECD, but rather than specific tactics within it. And to me, that means trusting partners, trusting those communities and leaders who are on the front lines of this. We believe in grassroots grant making. So really working with and letting tribal communities and organizations plan their own efforts and define their own success. And understanding that we as funders, for those of us in the funding world, really need to live up to the value that funders often claim, which is that they listen and that they are supporting community. And we need to really do that. And I think in this work, that is so crucial to success. And it means letting go of some of the power. And I think what's important to acknowledge as a funder that there's always a power differential. And part of what we believe in an aligned grant making process, that strategy can help us open that up and crack that open and build in that leadership and really strong power dynamic that really deeply values tribal leadership and community leadership. I'll turn it over to Patrice for the second strategy.
My thoughts today around knowledge building and how we share this knowledge really go around, really focus around the cultural lens. So most often we assess program effectiveness in the short term. And we know that that early childhood development is really a long-term investment with multidimensional inputs. So we embrace both the short-term and the long-term, as well as this multidimensional prism to evaluate success and impacts of this work. We certainly appreciate the evidence gained from tracking and assessing early childhood development programs. And I think that has a very important role and message for all of us to learn from in terms of students served and progress and so forth. And that means, though, that in our Native communities and with our Native children and families, our evaluation tools should really reflect more than the number of children participating in ECD. So we really want to look at this work through a cultural lens and see what factors both build up resilience and create coping skills. And this could include language and music, cultural practices, and storytelling. Ultimately, we want to create culturally competent evaluation models that also, in turn, build community capacity. So there's a lot of inputs here, and it's very much based on the community. Finally, we know that teachers are very much at the crux of this work. They are the most important influencers, aside from family and community, with respect to the development and learning of our children. So we want to focus on and create really positive and relevant and responsive professional development opportunities and curriculum for our teachers. They are the leaders of the classroom, and they are the influencers of our children, and they create a very important, critical learning environment for our children. So all of this goes together in terms of the funds, the support, the resources we need to promote early childhood development programs in our Native communities. I'll turn it over to Chris. I'm sorry, back to Andreas.
Thanks, Patrice. So the next strategy is around convening network building and collaboration. And I have to say the enthusiasm with which people registered for this webinar is additional fuel for my optimism around this piece. It's been tremendous response, and we've had some tremendous energy around the launch of the report in late March. Communication from all over the country, I'd say, not just in Minnesota, but I think we're really onto something here. And collaboration in this space, as in most spaces, is going to be so crucial to success. And what we know is that there are people, as we've outlined, doing tremendous work and creative work across the state and beyond, and that the lessons and learnings that are coming out of White Earth and out of the Lower Sioux community and elsewhere are things that we need to gather and share and discuss, and that means funders, that means frontline implementers, ECD providers, tribal leadership. It means connecting across different sectors so that partners can develop collective understandings about what's necessary for Native children and communities to thrive. We need multiple touch points between those communities and those partners and organizations, because we know that everyone comes with their own resources and their own perspectives and their own knowledge and their own gaps in knowledge. I certainly have plenty of those. And so building that authentic collaboration, it takes time and it can't be forced. So as we've pursued this work over the past year, it has taken time because we've needed it to take time. And I think there's an ethos in that, and it goes back to those core values for this work that Crystal laid out. Core values are really important to this work, and being true to those so that we can continue to hold ourselves accountable and invite others in to hold us accountable. We're talking about collective action. We're talking about bringing people together in organizations, institutions, nations together to tackle deep-rooted problems. And so supporting innovative cross-sectoral partnerships and collaborations between Native and non-Native stakeholders at the local level, the state level, and the national level means bringing folks together, making new connections, listening, sharing, and I think that's baked into what we propose for the path forward. I'll turn it back over to Chris then for the fourth point.
Thanks, Andres. The fourth strategy that we have outlined in our report is around advocacy and policy change. And in the report, we've identified three specific things that we are interested in working on, though undoubtedly there will be other areas for policy change and advocacy that can emerge as we move forward with this initiative. The three things we identified was developing comprehensive data about Native American communities and children in the state, and assessment tools relating to ECD, Native youth nutrition, and other things that can help drive policy development. And any of you who have done any work in Indian country know that there are additional obstacles towards collecting, developing, and analyzing data. And we think this is extremely important for purposes of influencing policymakers at the state, local, and tribal level. The second is to seek and ensure input and buy-in from tribal leaders, Native communities, Native practitioners. We were very intentional last year as we held a series of convenings to ensure that tribal leaders and practitioners were separately engaged for in-depth conversations, and for any sort of work going forward around policy change and advocacy, it's important to have their buy-in, both in reservation settings and in non-reservation settings in Minnesota. And the third thing we identified was the need to map and identify existing policies that create barriers for things like certifying Native ECD and language teachers, and to determine ways in which we can simplify and streamline that process to be able to build greater capacity in this state. those are just three things. As I said, there are additional things that could be done. And all of this really goes towards engaging in larger systems change. Analyzing the sort of upstream societal conditions that are important to take into consideration, supporting a more holistic approach to foodways and culture, and integrating those into programs that can support families and children, and looking at things like mental health resources for young children as well. Crystal mentioned on an earlier slide the importance of equity. And we recognize that it's important to raise the awareness among policymakers, thought leaders, opinion influencers in the state, and yes, funders, about things relating to implicit bias, generally the sort of invisibility of Native Americans, even in this state with a substantial Native population, and generally just the simple lack of understanding about the kind of unique legal and political differences that Native Americans face in this state. So those are the things that we see as being attached to the work around advocacy and policy change in this area. If we can go to the next slide, Andreas and I want to sort of tag team what really are the next steps and the things that we're called for in our report. The first step in sort of the next phase of the Healthy Children, Healthy Nations initiative is the creation of a collaborative fund. Both the Better Way Foundation and the Shakopee, Mdewakanton Sioux community have each pledged $100,000 towards the creation of a collaborative fund over the next year. We are hoping that other funders will join us. Our ambition, quite frankly, is by the end of this calendar year, we want to have this fund about $500,000 in size. We are interested in growing the fund beyond that in the years ahead. And the purpose of this fund is to support a number of different activities. We want to provide the resources necessary to invest in promising models, to invest in capacity building, the sort of knowledge building that Andreas touched on just a few moments ago, and other programs that have shown their effectiveness and their worth. We're thinking that this collaborative fund would fund planning grants that can be used to support a variety of stakeholders working in Native communities to develop new programs, project implementation grants to support the application of existing models and promising models that can focus on one or more of the focus areas and strategies that we've identified, and conceivably some other funding activities as well. With that, I'm going to turn it over to Andreas to touch on the Funders Collaborative.
Great. Thanks, Chris. And we know that not all funders are going to be either empowered to or inclined to put money into a collaborative fund, and that's okay. The second piece of the strategy is around creating a funders collaborative. So the HCHN partners are planning to launch the HCHN Funders Collaborative in partnership with funders who are interested in coordinating their grant making, but again, not putting the funds into the collaborative fund. The purpose would be to create opportunities for philanthropy to participate in knowledge building, networking, and collaboration, as well as aligned grant making that relates to our focus areas and the strategies, principles, and values that they embody. The collaborative would be another vehicle to bring resources to bear and build partnership beyond the HCHN Collaborative Fund. And we think there's the space is big enough. The space is we need to bring and mobilize and cultivate and support resources from a variety of different funders. And we think there's such tremendous opportunity that the way in which funders enter into this work is going to be diverse, and we're very much willing to work with that. And we think there's tremendous opportunity in that. So the Funders Collaborative is another way to help facilitate that. Back to you, Chris.
The third next step is we are planning to convene a statewide conference this September. It will be hosted by the Shakopee, Mdewakanton Sioux community at its new Mystic Lake Conference Center in Prior Lake. last year when we did the 3 separate convenings of practitioners, funders, and tribal leaders, we were really touched by the knowledge and creativity and commitment of everyone in each of those 3 sectors, and immediately recognized that if we're going to make any sort of success moving forward, that it is important to pull together all those who are stakeholders and interested in investing in Minnesota's Native kids. And so the idea of having a statewide conference to be able to reunite everyone, to share the fruits of the work that we've done up to this point, and then to plot out a concrete plan for collective action seemed like exactly the right sort of fit. The Shakopee, Mdewakanton, and Sioux community is going to financially support this conference. We are looking for other funders to join with us in sponsoring this. We're hoping to gather participants from all interested stakeholders, and hope that many of you on this webinar call will join us. And Andreas, if you want to just cover the last item.
Very good. And as we're moving ahead, we're already having conversations within the advocacy space. So the Healthy Children, Healthy Nations partners will start and continue to conduct briefings on the final recommendations and next steps about the HCHN project for Minnesota's tribal leaders and state policymakers. So our goal is to secure their endorsement for the framework, and really lay the groundwork for policy changes and funding increases from the state of Minnesota in support of comprehensive Native ECD efforts. It's going to take some significant groundwork to make that happen, but we're optimistic that we can get things moving. HCHN will also work with groups like the Start Early Funders Coalition, of which Better Way is a member, and Mini-Minds to ensure that priorities for Native children and communities are represented within their statewide advocacy plans in 2018 and beyond. We presented some of the findings from this with Crystal's leadership to the Start Early Funders Coalition, and I was impressed with the degree to which there was energy in the room around that conversation. There's a real, I think, growing appreciation within the foundation community in Minnesota for the challenges and opportunities in this space, and a real I've left those conversations thus far with a sense that we're going to find ways to work together on some of this, and that's exciting. And finally, HCHN will continue to follow up with Native practitioners and tribal leaders, funders, and other stakeholders to seek feedback, share ideas, and build relationships that can help advance needed policy change. Taking the time to build those relationships and listen and reflect and share is, as I said, essential to this work, and we're going to keep doing it. And that's certainly our commitment from the foundation side. I know our partners believe equally in that, and everyone who's on this call is very much part of that process, and we're looking forward to continuing those conversations. Crystal, why don't I turn it back over to you? I believe that's next.
Yes, thank you so much, Andreas and Chris. And Shirley, next slide, please. So I want to thank all our panelists, and so we do have about 10 minutes left to answer any questions. And again, we want to remind you to please submit your questions via the chat box. We do have questions, and I want to, Chris, I want to come to you with this first one from Wendy Stevens, and she says, I'm a nutritionist in school to be a registered dietitian dedicated to taking self-sufficiency and nutrition into the highest risk Native populations in the nation. Reservation of Wyoming are looking for programs and startup advice to bring all of your wisdom and programs to these people. Where should I start? So, Chris, what kind of advice do you have for Wendy?
Well, first of all, let me just talk for a moment about Shakopee's interest in the Healthy Children, Healthy Nations initiative, and that really comes from the standpoint of improving Native American nutrition overall. It's a nationwide campaign. Our website has a number of resources. Most importantly, Wendy, I would suggest if you want to reach out to me directly or through the seedsofnativehealth.org website, we would love to put you in contact with people who might be able to best provide you with ideas and additional resources to accomplish what you'd like.
Thank you for that, Chris. And I think also it's, that's what's so exciting about this project and really bringing together, different stakeholders are really working in this area and that have really similar questions and concerns, and really how do we build these networks for peer learning and sharing around best practices for programs. So the next question we have came from Kenneth Dennis, and Rob and Andreas, I'd like you to comment on this one. And Kenneth's question is the change in tax policy going to destroy grants? So Rob, do you have some thoughts on that?
Sure, and just to start with, coming from as a staff member of the Federal Reserve, Federal Reserve is in charge of monetary policy, the flow of money and credit in the economy, not fiscal policy. So we actually don't comment upon the tax and spending policy of Congress. So my comments are purely on what is being observed and what we're hearing from other stakeholders in the field. And that there is just immediately, while the tax policy change in the past few months, which was a reduction in taxes, has not directly led to a spending decrease. In fact, in early childhood and childcare, Head Start, and also home visiting, there were some sustains and gains in spending for early childhood. I think in the long run, observers are just concerned to watch out where those tensions between revenue coming into the federal government may have an impact on future decisions about fiscal spending. I think the recent gains that have been observed in early childhood speak testament to an important bipartisan approach to reaching out to lawmakers on both sides of the aisle so that all lawmakers are understanding the importance of investing in early childhood and to raise the concerns and particular needs for Native American communities.
Thank you for that, Rob. And Andreas, do you have anything you want to add to that, just from a foundation perspective?
Yeah, from a foundation perspective, I would say that so far the effect on foundation grants, I think, has been negligible. I think there's, I guess for me, the broader truth around this is that the foundation world continues to either essentially not see Native communities or see them with the age-old stereotypes and negativity that are not productive and fair. And so big picture, as we're moving forward, we're hoping to bring more foundations into this. Certainly as as tax policy affects philanthropy as a sector, we'll be watching that from the Better Way side. But I'm optimistic that there won't be any particular impact from the tax policy.
Great. Thank you so much for that, and want to encourage folks to keep submitting your questions. But while we're waiting to see if any more questions are going to come in, I do want to just really give a wholehearted thanks and shout out to so many of you who are actually listening in today that were really important contributors to this report, and some just absolute rock stars out there and the important work they're doing in early childhood development, nutrition, and health. And, we want to send our best to some of our, especially in the stories of impact that include Barb Faber and Lee Turney, and also want to thank Allison Babb and Blue Cross Blue Shield. A lot of people contributed to not only these dialogues, but really being an important sounding board as the partners really put together these recommendations, the final report. So, I guess I'm on, in final thoughts, in terms of, our three partners, just to see if, any final thoughts that you want to send out to folks out there as we look ahead. And this is a really ambitious idea and framework. So I want to invite any of you just to kind of thoughts before we sign off.
This is Patrice from the Center for Indian Country Development, and I'm just very excited about this work, and I'm very grateful for our partners that we brought together. And I'm really, really looking forward to engaging with the community, that we can build positive circuit boards that support both critical thinking skills and stronger resiliency, and to create really thriving, dynamic communities. So thank you all very much.
Crystal, this is Chris. I would just offer too that I think that there is a unique opportunity in Minnesota, but one that's not where the benefits, I hope, won't just accrue in Minnesota, but will be shareable nationwide. In that, in Minnesota, and largely because of the efforts of the Minneapolis Fed, there's been a high degree of understanding about the importance of early childhood development, especially in disadvantaged communities. There's been a lot of public discussion and increased understanding about the importance of early brain development, which is why nutrition is such an important component. And with the sort of creativity and dynamism that we see in Native communities, again, both on and off reservations in Minnesota, and the commitment from the philanthropic sector, which is exemplified especially by the Better Way Foundation, we have, I think, a unique opportunity focusing on Minnesota Native youth and what we can do to significantly increase ECD, childhood nutrition, and other efforts that really will help build up and sustain the Native population in Minnesota for the future. So I hope for those who have listened in, who have read or will read the report, that you'll consider the opportunities to join us. This really is a unique constellation of ideas and energy and focus that so many bring to the table, and we hope you'll join us as we try to advance things in the future.
And this is Andreas. Just briefly, and I think our partner said it so extremely well, so I don't have to go on. But just this is an effort that truly has opportunities for wide involvement in a really positive way, and we're going to want and need so many of you to be a part of that. From the Better Way Foundation perspective, we're looking forward to the conversations ahead. We invite you to reach out to us. Our websites are going to be updated very soon, but my email is on there, so don't hesitate to reach out. BetterWayFoundation.org. We are, if nothing else, we are going to be learning, and we are going to be creatively finding that strength that we know is there, and working with tribal leadership. The privilege that we have in working with tribal communities on this and with our other partners on this is one that we don't take for granted. And as we move forward, we're going to continue to hold those values that we laid out earlier at the core of this work, and we look forward to doing it with you. Thank you.
Thank you so much. And we've had a couple last-minute questions and comments come in, so we'll try to get through those in the next minute or so. And we had a question come in from Sarah wanting to know how folks will get information about the upcoming statewide conference. And so we encourage you to go to seedsofnativehealth.org, and under their tab, you'll find the Healthy Children, Healthy Nations project page, and that's where you can go for all information and updates regarding whether it's going to be the new fund that is launched or the statewide conference. We also had a question come in from Barb, who wondered if there was going to be an opportunity or intent to be able to leverage the Healthy Children, Healthy Nations Fund with federal grants. Andreas or Chris, do you want to take that question?
Sure. Just from my perspective, I would love to leverage federal grants, and absolutely creative thinking around that is what we're going to need. The way, if and when people have ideas of how and move ahead, we're all ears, and we're going to look forward to those conversations. I mean, part of what I think underlies this is that we want to get really creative around how we mobilize resources and how we support this work. So thank you.
Great. And then thank you for that. And then actually, Andreas, we have one more very specifically for Better Way. And this question is coming from Sherry, Brooke. And it says, it seems the Better Way Foundation funds multiple projects concerning early childhood development in Indian country. Will there be any opportunity to connect and coordinate some of these efforts to improve outcomes?
Absolutely. And I think in Minnesota, Part of that is the convening that Chris talked about this fall. That's an important moment. As a foundation, we're in the process of convening our many partners, and that goes not just in Minnesota, but also partners that we have down in New Mexico and on the Pine Ridge Reservation in South Dakota. We believe that connecting and finding ways to bring partners together and to bring others who are perhaps not funded partners by our foundation, but who are working in this space and from whom we can learn and to whom we could bring value. Bringing folks together is something that we're very much interested in. So the specifics on that will continue to develop. And again, we're open to suggestions and ideas. So thank you, Brooke.
Thank you so much. And, you know, we're a couple minutes over, so I think we're going to go ahead and wrap up. But I do want to share, Sherry wanted to share with everyone that they now have an Indigenous Breastfeeding Coalition of Minnesota that's convening its first gathering in Bemidji. And that traditional first food and breast milk are very important. And that was certainly something that came up in the research and definitely a focus of our focus area around early Native nutrition. So with that said, I want to thank you all for taking this last hour out to learn more about the Healthy Children, Healthy Nations initiative and final report. And we hope again that this is just the beginning of not only the conversation, but the work ahead, and cannot be done alone by these three partners. We really need you all to weigh in and do a lot of advocacy around this. And again, we want to invite you to stay tuned and stay abreast of the by visiting seedsofnativehealth.org and click on the Impact tab, and you'll see Healthy Children, Healthy Nations listed there, and then the homepage. So on behalf of the Shakopee Mdewakanton Sioux community, the Better Way Foundation, and the Center for Indian Country Development, we want to thank you, and we look forward to the work ahead. Have a great day.